Hey guys, Max here, and I am 9 days post-op top surgery. I had gone to Dr. Cori Agarwal at the University of Utah in Salt Lake. Um, so I still have to wear the vest. However, I'm allowed to take it off for a couple hours a day, so I'm taking a breather right now. um, Anyway, back on the 1st of June, a couple days ago, I finally had my big reveal, and I was able to get the drains taken out and all the stitches taken out. So I do have a picture of what it looked like 1 week. It is pretty gross. I'm not gonna lie. It's like I keep trying to think positively and look at it and realize that a lot of the swelling will go down. A lot of it is going to change over the next few weeks, but the doctor did say that everything looked pretty good. She was saying that the nipple grafts, that's what you want them to look like. She thinks it looks really good. Had a little more swelling on the right side than the left, but it should heal up okay from what she could see. Um, since then, she said I'm allowed to shower, so I've finally been able to shower, which is so nice. Sort of. It's nice to be clean, but I got in that shower the first day and the water ran down my front, and I'm like, owie, owie, owie. Like, it was kind of like when you sprain your ankle and you have your shoes on, and then you finally get to take your shoe off after you sprain it and it's all swollen. So you take the shoe off and you get this rush of blood to that area. That's kind of how it works with the chest. Like, you take the binder off, and after a little while of it being off, you can start feeling it swelling and like it hurts. So she said that I'm allowed to have the vest off for a while, for a couple hours a day, but I take it off long enough to take that shower, get dry, get new bandages on, and I throw it right back on because it starts hurting after a while of the vest being off. I wasn't really expecting that, but like I thought I'd be like so relieved to be able to take this binder off. I'm like, oh, I can't wait till I don't have to wear this stupid thing anymore. But it feels a lot better now to have it on. Now that all like the gauze and all the padding and stuff underneath is gone, having that vest on isn't that bad. It still kind of rubs, hence the t-shirt. The binder had been rubbing a lot on the side, so I have a lot of spots that were rubbed raw, and were actually like they're bright red streaks that were rubbed, like they were really bad. So she suggested putting a t-shirt on, or the doctor suggested putting a t-shirt on to kind of minimize the rubbing. So, excuse me. So I've been wearing a t-shirt underneath the vest to try and help with that. Um, I thought about doing a video without a shirt and showing my chest, but I put the bandages on this morning, and you have to change them every morning, and I don't want to have to try and put new bandages on, so I'll be able to stop using bandages in like 2 weeks, a little less than 2 weeks now. It'll probably be about the 14th that I'll be able to not have to use bandages, and it should be healed enough that I can start using like scar guard and massaging it, and I won't have to wear that vest anymore. So I have about 2 more weeks before I cannot wear the vest anymore, and before I can stop using the bandages. Funny enough, my chest actually hurt quite a bit more after like the first week of surgery. The first couple days wasn't so bad, and then it started feeling kind of bad because of the vest and all the drains rubbing. But since she's taken all the uh, sutures, all the stitches out, Like there's only one stitch left in each nipple that's still in. So all the rest of the stitches are out. And after having all of that out, it actually hurts a lot more now than it did back before. So like the second week has actually been like worse than the first. And I'm so used to my hip surgeries. So after the hip surgeries, it just slowly got better and better and hurt less and less. And for some reason, this stupid surgery, like the first couple days are fine, and then it slowly gets more and more irritating as time goes on, and it seems to just be hurting more and more. So, like, I was all like, oh man, this is easy. This is no problem. Easy day. Uh, like, I was feeling really good about my surgery because I wasn't hurting all that much. And then I get all the stitches out, and I'm like, oh my god, this hurts. My fiance is like, stop being a baby. It's like, stop whining. You wanted this. I'm like, I do. Like, okay, so this is my hard thing about a lot of this is that if you whine about it, people are like, well, you chose to do this. This was your decision to do this. And it's like, yeah, I did choose to do this. And like, they feel like if you complain about the surgery or you have like issues with it or something, all of a sudden you're just a depressive, like whiny little bitch. So I'm like, just because I'm complaining that it kind of hurts, and just because it's kind of frustrating to go through, does not mean I didn't want this. Like, it's one of those things. It's like, just because it kind of sucks doesn't mean I'm not happy that I got it done, kind of thing. Like, it really kind of sucks right now, but I know that in like a month, when it starts really healing up, and I'm able to actually start doing like some light lifting and moving, and I'll actually have a little bit more movement, I'm really going to love my new chest. But right now, it still has like open parts, and it's sore, and the nipples are still reattaching, and like it doesn't matter how much you want something. If you have to get cut open for it, it's gonna kind of suck. You know, I mean, I know it kind of frustrates me because you complain about top surgery a little bit, and then people are like, well, you know, you didn't have to get it. And then they get all like butthurt about it. And I'm just like, okay. Yeah, just because I hate what I have to go through to have this, like, yeah, I chose to have this. I could have just kept binding, but I wouldn't have been able, like, I guess I could have been in the Mel locker room, but that would have been really weird to be in there with the chest that I had. And actually, if I didn't have to be in a locker room at work, I don't think I would have cared. I probably would have put off having top surgery for a while. My big thing is I wanted to be in the Mel locker room, and I have to go in the locker room to change at work, so I needed this. The only reason I was pushing it. Not that I didn't want this, I want this, but I would have probably postponed it and done it a lot later so that I could have been a lot more prepared for this instead of like pushing it really, really fast, especially having just gotten into our new house and everything. So I kind of jumped the gun on this just because there were certain things that were getting very awkward for me at work. It was mainly a work issue that I really pushed hard to get this done fast. Um, so basically, my thing is that just because it kind of sucks, and yeah, I did choose to do this, like, I spent the money and everything, I wasn't going to necessarily die per se if I didn't have it done, but it kind of feels like you will. Like, having to look at that woman's room, the stupid word woman on the locker room door every time I walked in there, every morning going to work, being in the women's locker room, women all around me. I have a fucking beard, and I have women all around me while I'm in this damn locker room. And having to put my uniforms in the woman's uniform spot and having the female uniform. I mean, luckily I was able to get my preferred name on my uniform at work, but like, just every day having to go into the women's room, day after day, and like, having those people, hey girl, do I fucking look like a girl to you? Like, really? Like, it just, it starts nagging at you. It just chips it away. And it starts getting sore. So just because I vent and complain a little bit about the pains that I'm going through right now to get this done does not mean I didn't want this. That's my in a nutshell. I mean, okay, the one thing that makes it all worth it is this right here. You see that? You see that it's flat until you get to my big old gut, but it's flat. I don't have a binder on. I'm not wearing a binder. I am free. Like, I can put on a t-shirt and be fine. I do not have to bind. And even with my binder on, it would look like my chest was like clear out to like here, like with the binder on, because I had pretty big chest. And now, nothing. There's nothing. I have pecs. This is what makes it all worth it. Is to stand here in just a t-shirt and have a flat chest and to be able to go outside just like that. That's what makes it worth it. Like, it may kind of hurt right now, but I'd rather have a little bit more pain for these next couple weeks than to have to deal with the pain of walking into that woman's room every fucking day. Or the pain of having to wear those fucking binders. Like, having to wear a binder outside when it's like 90 degrees. Even if you're wearing like a sleeveless shirt, it doesn't matter. You've got that binder and it's drenched in sweat. All down your back. You can feel the sweat all over you, and you're like dying because you can't breathe. You're like getting dehydrated because you're sweating everywhere. And it's like peeling it off of you, and then the pressure on your chest, you can't like do anything. Like, I am so amazingly happy that I will never have to do that again. Like, for everyone who has ever had to bind, you understand what I mean by the frustrations of binding in the summer. And I don't have to do that this year. And that is worth going through all of this. So yeah, it kind of hurts. It's sore. It's swollen. Getting in the shower kind of stings, and I have to use the stupid gauze and stuff. But I have an amazing fiance who has been amazing. Like, he's been helping me get all the bandages on and taking on and off my shirts, and like doctor said, I'm allowed to wash my hair now, but he's been doing it for me because it still kind of hurts. Like, I can kind of reach my head, but it's still kind of tender when I reach up, so I don't like to do it. So my fiance has been helping me like actually wash my hair and make sure that like he washes up my back and scrubs me down. Like, he's fantastic. I don't know what I would do if I didn't have him. Like, he is definitely a godsend. Anyway, wow. I made this video way longer than I thought I was going to. I just wanted to do a quick surgery update. I think my next update will probably be after my next appointment, which is on the 13th of June. And that's when they'll be able to tell me, like, that I don't have to, like, whether or not I can stop using the gauze and the covers, etc. So I'll probably post another update when I'm able to not wear any of the gauze and the bandages and stuff, and when I don't have to wear the vest anymore. So I'll probably do another video when that happens. Anyway, thanks for watching. As always, hit me up if you have any questions. Thank you. Bye.